And loud.
Don't we say that about most of our women?
I guess.
Yeah.
That's true. Well, so it's always going to be there. But is she always going to take, is this medicine good for her to do it?
Well, what's going to happen is once you get to the point where I'm confident that we're as good as I could possibly make it with the medication, we'll quit. And then at some point in time, one of those spores will rear its ugly head and we'll be looking at a similar disease all over again. Okay. Now, there are those rare cases where it's gone completely. Like I said, it all depends on the organ systems and where, what organ systems it's gotten into. If we're just looking at, a simple tracheitis that caused this, or not, it's got, well, it's all right. Let's do this. I have to assume respiratory tract and enteric tracts. In other words, we know that it's in the way she was breathing. It was in her respiratory tract. We know because the fact that we're finding it in the feces itself that it's actually in there as well. So there's a lot of places in between there, liver, kidney,
right.
That this stuff could be sitting in. I mean, just the respiratory tract alone, between air sacs, trachea, sinuses, the lungs, there's all kinds of places that those spores could be sitting in. Sadly, the air sacs, the walls of the air sacs are very, very thin. They don't usually, unless there is an infection, have a lot of blood supply in there, okay? So they don't heal as well as we'd like them to. So in other words, if those spores are still sitting in there and in part of that scar tissue, then as the scar tissue starts to fade and encapsulates these spores, it may pop up again.
Yeah.
So as a general rule, you may get lucky, you may never see it again, but I like my clients to be a little bit more realistic.
Yeah.
Okay.
And in which case she'll start drooping her wings and changing her habits, and I would know it, because otherwise I'm not going to know it. So.
I mean, you've already been through it. Now we know what we don't want to see happen again. Before,
right.
I was scared to grab her up and do what I had to do to her because she had a real shortness of breath. Her tail was moving. She looks beautiful now. She's coming around.
Yeah, she's fine. She's fine. I mean, she's back to normal. I've noticed she's a little bit skittish. I didn't know whether the medicine was having it make her feel a little bit shaky or nervous. Last night she came down off the cage and I'm sitting in my chair. She comes over and I stick my foot out. She comes up, and I noticed she was like quivering, shaking a little bit. And she normally doesn't do that, but then she stopped and hasn't done it since. Nervous,
right?
Shaking.
You think it could have been the weather?
She could have been anything. Okay. That's the only thing that I've noticed in, other than the situations that you already know about. That I haven't noticed anything else. She's not breathing. Now she's breathing a little bit different here, but that's because she's here. Yeah. She hasn't been.
She's got a nice slow respiratory rate today. That's pretty much normal. That's good to see. Real slow and bellow.
Yeah.
It's just.
So I'd say she's pretty normal. Now, how long is she gonna have to take the medicine this time? Because I'm scheduled to go out of town.
Let's continue it for just another week, just to be safe. Then you can quit for a while, and we'll see what happens.
Okay.
Okay.
And I'll probably have to get more medicine. I think there's a refill on that medicine.
I did tell them you could have a refill. What? Hey, I know. Dad wants to catch you up and trim your nails. Are you ready for this? Are you ready?
They were supposed to do it in Diamond Head, and I don't think they did because man, she's been tearing me up. And I don't know. Once you trim them, once you cut, I file them if I can.
Mm-hmm.
She doesn't like it, but I file them. Well, how do they get sharp? How do they get pointed again?
Well, you got like rocks and stuff in her cage.
No,
they'll sit there on a piece of wood and they'll sharpen their claws, and as they grow and wear, they sharpen naturally.
Well, I guess that's what it is.
Okay.
I'm old, and man, she just has to get close to me, and she'll pop a hole in me. I'm a lot of blood. It could hit a vein. I'm serious.
Dad completed them. Yeah. Look what you're doing to your dad. All right. For those of you who are watching this video this late in this conversation, this girl here was brought in. She was being treated at another veterinarian for diarrhea, complete with metronidazole and some of the medications. When I saw her for a referral or just a second opinion, we went and did some minor testing. It was pretty obvious that she had a respiratory tract infection. We then went and cultured and got back some Enterobacter cloacae and some other things that really are not that abnormal for a bird, but she should have turned around a whole lot better with the antibiotics. Anyway, by continuing looking at fecals and so forth, and actually getting a swab, we did notice some fungal stalks and some fungal spores, and at that point in time, we made the large assumption that we were looking at a sporulated type of fungus. And whenever we think of birds as sporulated fungus, we think of aspergillosis more specifically. Since then, we have started treating her. She's always had this little bit of a hanging wing thing going on, but her feathers are much brighter. Her eyes are much brighter. Let's see inside her face. You're so funny. That's cool. I thought you'd bite the camera. I was giving you a chance there to, like, give a quick bird endoscopy.
She's kissing it.
You kissing the camera?
She likes that sound.
You're very cool. Well, I've got to take my phone out of my pocket. That's someone trying to continue with catching up with me. Anyway, so she's been on antifungals now for about 3 weeks to a month.
At least.
Yeah. She is much improved. Her stools are quite formed now. As of this fecal that I just did, I did see one fungal spore in the intestine, and it's a small sample, so that's just diagnostic of the fact that the spores are still there. And so Dad's going to continue the antifungals for another week, and then he'll discontinue it, and we'll see him as needed. When it comes to this disease process, most of my patients end up being treated several times, simply because it is a sporulated fungus, and sporulated funguses just don't want to go away. That's why they make spores. All right, that's enough of the bird for now. What? I have to catch you up. I have to trim your nails. Dad's going to make me do this to you. You ready? Yeah.
It's a kiss.
Kiss.
It makes a kissing sound, too.
Yeah. What? What?
She is real smart, by the way.
Oh, they all are.
She has got her act together.
If you had an opposable thumb, I might have to worry.
Mm-hmm.
Yeah. What? Okay, I'm turning this thing off. I have to get a towel, and then we're doing your nails. Are you ready?